Okay, so next we're gonna assess for nasal patency. So I'm going to close off one side of your nostrils and have you breathe in and breathe out, and then I'm gonna switch, okay? Okay, so I'm gonna have you breathe in, breathe out, breathe in, breathe out. Very good. Okay, so you were able to breathe in and breathe out like normal, so you don't have any occlusions, which is normal, that's good. The next thing I'm going to assess is your mouth and throat. So I'm going to have you open your mouth, and I'm going to look at your teeth, your gums, your oral pharynx, your tonsils, your tongue, and your buccal mucosa, and just make sure that you don't have any abnormalities, okay? Okay, so your tonsils are about a +2, which is normal, and you have intact teeth, you have pink moist gums, you have moist normal pink colored buccal mucosa, and you have no signs of ulcerations, lacerations, or irritations. The next thing I'm going to have you do is I'm going to have you stick out your tongue and say ah, and this tests your cranial nerve 9 and 10, which is cranial nerve 9 and 10, which is your glossopharyngeal and your vagus nerve. So I'm going to go ahead and have you do that for me. Okay, very well. So your tongue or your uvula was vibrating whenever you did that, which is normal. And then I would also at this time test her gag reflex, but for the sake of this video, I'm not going to do that to you. But that would also be those cranial nerves as well. So the next thing I'm going to do is move on to your neck. So I'm just going to look at your neck, and as we can see, it's nice and symmetric. There's no abrasions, no lesions to it. It's nice and warm. You don't have any discolorization or bruising. You have nice skin turgor. I'm sorry, are you okay? Mm-hmm. And so the next thing I'm going to do is test your range of motion. So this tests cranial nerve 11, which is your accessory nerve. So I'm just going to place my hands on top of your shoulders, and I'm going to have you shrug against me, okay? Go ahead. Very good. And then I'm also going to test your range of motion of your neck as well. So at the same time, I'm going to have you take your ear to your shoulder, tilt your head back. There you go. And tilt your chin to your neck. Good job. And then I'm going to also do it again, but with resistance, okay? So go ahead. Very good. Other way. Good. And down. Very good. Okay. And so I'm also going to test your carotid arteries. So I'm going to have you look up just a little bit, and I'm going to palpate those. So I would get a recording, and we'll say that it's 84, which is normal, beats per minute, and it's +2, which is normal as well. And then I would do the other side, and then it should be symmetric bilaterally. And then next, I'm going to just assess your trachea. So I'm going to have you look up. As you can see, it's midline, and I'm going to try to move it just to see if it's freely movable, and if you have any pain, let me know, okay? Okay, very good. So it moves very slightly, and it's freely movable. The next thing I'm going to do is have you take your back to the side of the bed and face that wall for me. Very good. And I'm just going to assess your thyroid gland, okay? So from behind, I'm just going to assess, and I'm going to have you swallow whenever you tell me to, okay? Whenever I tell you to. Okay, so go ahead and swallow. Very good. So she was able to have her thyroid gland move upon swallowing. So I'm going to have you face me again. The next thing that I'm going to do is assess it from the front as well, so we're going to do the same thing. I'm going to assess your thyroid gland. There's no swelling, and I'm going to have you swallow. Very good. So it also moved. I'm also going to listen to it to see if you have a bruit, okay? So I'm going to have you look up just slightly. Okay, very good. Very good. So there were no bruit mentioned. And so the next thing I'm going to have you do is just lay flat on your back for me. And I'm going to look for any pulsations of your jugular vein. So any distension I will note, but I'm just going to have you look at that wall for me for just a minute. So as you can see, there's no pulsations, no distension, so that's very well, and I'll help you sit up, and you can just sit back up with me. There you go. And so The next thing we're going to do is move on to your chest and lungs. Is that okay? Okay, so I'm going to do the back and the sides of your chest and lungs first. So again, I'm just going to have you face that wall for me and just come right back here. Very good. Okay, so we're first going to assess her shape. So as you can see, she's sitting straight up, which is nice and erect, and she has a very elliptical shape of her thoracic. Her shoulders are nice and even bilaterally. She doesn't look like she is uncomfortable in any way. She also, so I'm gonna go ahead and palpate your spine. You let me know if you have any tenderness, okay? Any tenderness? Okay, so she doesn't have any tenderness upon palpation of her spine, which is also good. I didn't feel any masses or lumps either. The next thing I'm going to do is check her for symmetric lung expansion. So I'm just going to take my thumbs, just like this. Okay, and I'm going to have you take a deep breath. Okay, let out. Very good. So as you can see, my thumbs moved apart evenly and bilaterally as she took a deep breath in, which is normal. That means she has symmetric lung expansion. The next thing we're going to test for is tactile firmitis. So I'm going to place my hands over your scapulae, and when I say 2, you're just going to say 99, okay? Okay, go ahead.
99.
Very good. So I felt her vibrations in my hand evenly and bilaterally. The next thing I'm going to do is to percuss over her lung fields back here. So I'm just going to take my fingers just like this and tap on them just like this, and you let me know if you have any tenderness, okay? Very good. So did you have any tenderness? Okay. So she didn't have any tenderness, and we heard Renaissance bilaterally, which is very normal. The next thing that we're going to do is check for CVA tenderness. I'm just going to take my hand just like this against your kidney area, and I'm going to palpate, or to percuss just like this, and if you have any tenderness, let me know, okay? Any tenderness? Do the other side. Any tenderness? Very well, so she didn't have any tenderness, so that doesn't hurt or that means that she doesn't have any signs of infection or inflammation of her kidneys. The next thing I'm going to do is to listen to her lung fields as well as she takes deep breaths in and out, and I'm going to listen for any adventitious sounds. Go ahead and take a deep breath in and out. And in, and out, and in, and out, and in, and out. Very good. So I didn't hear any adventation sounds like crackling or wheezing or anything like that. That would be abnormal. The next thing that I'm going to do is have her go ahead and turn to the front for me again. And I'm going to test or check the front side of your chest now, okay? Mm-hmm. So the first thing you're going to do is just inspect it. So as you can see, again, her shoulders are still bilaterally even and symmetric. She doesn't look like at the skin, the open area of the skin doesn't look like it has any discoloration. It's nice and warm. It has good skin turgor. It has nice moisture. It's nice and dry, and it's pink. She does not have she doesn't look like she's using any accessory muscles to breathe. So the next thing we're going to do is, again, we're going to percuss your lung fields at the top, or in the front. So if you have any tenderness, you let me know, okay? Very good. So again, we heard the Renaissance that we want to hear. We didn't hear any abnormal sounds when we percussed, and they were equal bilaterally. So the next thing that we want to do is I'm going to again listen to your lung sounds in the front, and I'm going to listen again for any of those adventation sounds, okay? Deep breath in and out and in and out and in and out. Very well. So I didn't hear any crackling or wheezing again or any other extra adventation sounds that we shouldn't hear. And her breathing sounded nice and effortless. Again, we're going to go ahead and assess the lymph nodes. So I'm going to assess your subclavian lymph nodes, your central axillary, and your brachial lymph nodes, okay? So here's your subclavian. Do you have any tenderness? Okay. I'm going to check right underneath here. Any tenderness? Okay, and the other side. Any tenderness? Okay. And your brachial? Any tenderness? Okay, and the other side. Any tenderness? Very well. Okay. And again, we do have her in her scrubs, but a normal patient would be in a gown, and we would be able to take off the gown to be able to assess the skin throughout the entire head to toe assessment. But from what we can see, it doesn't look like she has any abnormalities. But again, in actual practice, we would make sure to take their shirts off when we assess our patient's chest and their legs. So I'm going to move on to your upper extremities. So I'm going to assess your skin. So again, you have even coloration bilaterally. It's very nice and warm. It's dry. You have good skin turgor, which means you're hydrated and you're not dehydrated. It's nice and warm. You have no discoloration or bruising or lesions or abrasions of your arms at all bilaterally. The next thing I'm going to do is test your range of motion. So I'm going to have you just hold your arms out just like this. Good. And take them in and out. Very well. And then down. Then back up. And then down. Very good. And then I'm also going to test him against resistance. So if you could just go like this for me. And I'm going to have you push down. Very good. And then take your hands just like this for me. Push against me. Very good. And just like this. Good. And pull against me. Very good. So her range of motion is nice and active. It's strong. She has very strong muscles, which is very normal. So very good. The next thing I'm going to do is I'm going to try to feel for her epitrochlear nodes, lymph nodes. So I'm going to go ahead and take your arm. And I feel. Is there any tenderness? Okay. Any tenderness? Okay. And again, all her lymph nodes so far have been unpalpable, which is normal because that means there's no swelling or sign of infection. I'm again going to test your radial and brachial pulse. So that's right here. This is the radial, and I would go ahead and get that measurement. So for the sake of the rest of this video, we'll say it's 84 beats per minute, which is normal, with a +2 bounding pulse, or +2 normal pulse. And then we'll do the brachial. Again, 84 +2, and then we'll compare it bilaterally. And we'll say both of these were 84 +2 as well, which is normal. And then the next thing I'm going to do is I'm going to go ahead and just listen to your apical rate and just test the strength of that, okay? Okay, so we'll say that's 84 beats per minute with +2, and there are no bruits present.